more than 300 organizations representing at least 45 million nurses, doctors and health professionals worldwide signed an open letter to 197 government leaders and national delegations ahead of COP26, warning that the climate crisis is the single biggest health threat facing humanity. Let's take this discussion forward now. We're joined via Zoom by James Irlam, the convener for Public Health Association of South Africa. James, thank you so much for your time this afternoon.
Thank you. Good afternoon to everyone.
Thanks so much for joining us. Now, as the Public Health Association of South Africa, I would imagine you are one of those organizations that signed that open letter and that our government is included in that 197 leaders that you've sent to. Now, talk to us about what the most pressing concerns are that you are raising about climate change.
So thank you. Yes, the climate crisis is a global emergency that has been recognized around the world. Scientists in the latest IPCC report have warned of the fact that we are running out of time to prevent the worst impacts of climate change. And for us, as a public health association and as a climate, energy and health special interest group, health is the bottom line of climate change. That what impacts on the climate impacts on the environmental determinants of health. And we're seeing that with the increase in extreme weather events like floods and droughts and heat waves. And so what we are calling for is urgent action on mitigating emissions from our energy system that are heating the climate, that are polluting our atmosphere. And we're calling for more resilient health systems that are bearing the brunt of climate-related disasters, and we're calling for health systems that are more sustainable, that are contributing less to the environmental impact of our institutions.
Now, with South Africa not going to COP26 in the form of President Cyril Ramaphosa, understandably because of the upcoming local government elections, how much of that, presence or lack of presence at COP26 sets you back in terms of what you are calling for, particularly in this country?
Yeah, that is unfortunate. Given that our president's recent communique this week has spoken about the climate crisis and also the opportunity to decarbonize our economy, starting with our electricity sector. And we feel that having the head of state at the most important climate conference in years signals that South Africa is committed to this decarbonization, that it is committed to creating healthy climate commitments. And we would, as a Public Health Association, urge the government representatives who are there to really take these concerns very seriously that have been expressed by health professionals around the world. And in a developing country like South Africa, these have particular urgency because of our vulnerability to climate, inequity and poverty. And this is an opportunity that we cannot afford to lose.
Now, at the back of the letter that several organizations sent to those different leaders, you also mention in your publication that, you draw some of references from the WHO, which also released a new report in which they argue that countries can only ensure long-term recovery from the COVID-19 pandemic by implementing ambitious climate commitments. Where are we as South Africa in terms of those commitments, not only from just climate change perspective, but just from a long-term health perspective in terms of bringing those systems that are needed in healthcare services. I mean, if COVID-19 showed us anything, it did show that there are huge gaps in terms of bringing those health divides.
So our latest NDC, which is our nationally determined contribution, or the commitments that we make to reduce our emissions under the Paris Climate Agreement, does rate quite well on its recognition of health. So it mentions heat waves and the health sector as one of those most vulnerable to climate change. It is included as a sector in the National Climate Change Adaptation Strategy. Air quality is highlighted as a co-benefit of transitioning to renewable energy. So that means that as we reduce our dependence on coal-fired power, so we're going to improve local air pollution. The commitment does mention the funding that is required for the adaptation strategy to be in the order of $3 to $4 billion, although it's not clear how much of that is allocated for health adaptation investments. And then finally, the climate commitment does speak about the right to a safe and healthy environment. However, the climate targets are still incompatible at the top of the range with the climate agreement, the Paris Climate Agreement target of 1.5 degrees of warming. And so that is something that we will continue to highlight, that all countries need to increase their climate ambition. They need to do it urgently, otherwise the costs of doing it later will be much greater. So overall, the report is saying the costs of acting now, and it will be considerable, are outweighed by the costs of not doing anything and having to deal with the consequences later on.
All right, James, thank you so much for your time this afternoon. Really do appreciate it.
Thank you very much.
James Irlam, the convener for Public Health Association of South Africa.